Good morning. This is Don Walters coming to you from TheClinicaltrialsGuru.com. Hey, listen, I want to talk to you today about the different trials, such as inpatient trials, outpatient trials, compensation, and degree of risk. Now, for those that don't know, you have inpatient studies. Inpatient studies is where you will go to a facility, some sort of medical facility, like a hospital or a subacute hospital, like a nursing home, and there are also facilities called IMDs, which are long-term psychiatric facilities. Usually, people who go to those type places are people who might be testing medications for psychiatric issues, and they may already have those issues. Usually, healthy normal studies are done in more of medical settings, medical hospitals. You won't see people typically placed in at least I haven't, placed in a psychiatric unit. Um, Inpatient studies I've seen last anywhere from one overnight stay to 50 days in that facility. They usually try to make you very comfortable. Some facilities that are set up right, they might have computers there for you can access the computer, areas for you to go smoke, access to cafeterias and stuff like that, but you cannot leave. You have to stay there because they have to have some sort of control over what's going on with that study. If people were leaving and coming and going, it's really hard to say what's happening outside of there because you don't know, and that can definitely ruin the study. Um, Inpatient studies, pay pretty well. They pay a lot more than I think outpatient studies because you're a lot of times dealing with brand new medication, and the risks are higher because you're not sure exactly how that compound is going to react on the human body. You're not sure how it's going to react with other medications. So those are usually early phase studies. You have, again, the phase one studies. A lot of times those studies are done with what's called healthy normal people, people who do not have that particular illness that medication is designed for, but they're willing to test that medication. I've seen compensation anywhere from a couple $1,000s up to about $77,000 during my time. Somebody else may have seen a little different, may have seen higher, may have seen lower. I don't know, but that's what I've seen over my past 10 years. Moving down to what's called phase two studies. Usually, those studies, inpatient, they're usually looking at a smaller group of people that can benefit from the medication. Let's say someone who has schizophrenia. They might bring in a small group of people and they're testing that medication still for safety and efficacy or the effects of the medication and collecting that data. They might get paid a little less than somebody who's done a healthy normal study because the risk is now stepped down a little bit. There's still some risk in it because, again, it's a new compound, but it's not as high as it was at that first level because if it was, it probably would have never made it to level phase two. And then, of course, when you get into phase three and phase four, the risk is not as high. Compensation is a lot less. And, of course, then, too, people who have that particular illness can benefit from that medication as well if it's working for them. Also, too, the other thing you have to look at sometimes, too, in these inpatient studies, there might be a placebo. And the placebo, a lot of times, it's just basic like a sugar pill. They're not really getting that particular medication that works for that illness. So that's another reason to be inpatient because you want to be able to observe if that person's not responding. If they're having problems, you want to be able to have them in a situation where you can rescue them. If they're outpatient, you can't do that. You don't know what's going on. Typically, what I've seen, my experience is that with outpatient studies, there's not a placebo. You're either getting that medication at some particular dosage. They might be looking at different dosages, or a big thing right now is sometimes it's looking at oral medication versus the injection, which is working better. Outpatient studies usually go in. Your visits can be from 1 hour to 4 hours, and all depends on what needs to be done. Because obviously, still there's a lot of cognitive testing that goes on, and there's medical things that need to be looked at: blood pressure, your heart rate, and all these things to make sure that you're healthy. I've seen outpatient studies last maybe 2-3 weeks, and I've seen outpatient studies last a year and a half. A lot of times, The visits I've seen anywhere from once a week, twice a week, to once every other week, to once a month. And I've seen them all mixed up as well, where you might go once a week and then once every other week, and then once a month, and then back to once a week, back to once a month, and then once every other a week. So it all varies. It all depends on, again, what they're looking for with that medication. Outpatient studies, I've seen compensated anywhere from $25 all the way up to $125. Again, that's what I've seen over my past 10 years. It all depends on that particular study. I hope that answers your question. If you have any others, please contact us at TheClinicalTrialsGuru. That's www.TheClinicalTrialsGuru.com. And this is Don, and I'm signing off.